health of the nation is wealth of the nation. So I'll at first like to go to the money man, if I may say, in the panel here, Mr. Sunil Thakur. Sunil, as you heard from Aryaman, Sunil leads one of the best quantitatively and qualitatively, Quadria Capital best organizations in this regard. And possibly Sunil has a better idea than any of us about what are the emerging digital business models, Sunil, and the kind of organizations that you think in future will attract investments, both in public health, but mainly in private healthcare. What is your take? How are things going to evolve? Aryaman mentioned about AI, ML, and all this kind of stuff. Those are reality. Where do you think, where do you think healthcare is going to go in terms of investment climate, in terms of prioritization of investment, funding, etc.? Sunil, up to you.
Thank you, Anjanda, and thanks to you, Madhur and Aryaman for inviting me on this platform. And good evening to everybody. So just to give my perspective, Anjanda and we have the fortune of investing both in growth companies through Quadria, which is our lead fund, and also in the early stage disruptor models through HealthQuad, which is a venture capital fund. So what we've seen in the past few months is that healthcare and more important, digital healthcare has become front and center of policy making. It's become the most talked about subject amongst consumers. And definitely in the past few months, the kind of activity that we've seen, be it consolidation, acquisition, it is now finding those right triggers for a market like digital healthcare to start sort of maturing and getting good traction from investors, from government, from entrepreneurs, from consumers. And that's good for somebody like us who is in the business of making investment. Now, coming to the point of what we've been seeing in the past few months, basically, digital healthcare has been in the play in India for now over a few years. But we were finding a bit of a challenge in terms of consumer traction, in terms of support, high-level support from the government, and on the enterprise side, encouragement from private and public healthcare players. What has changed is because of the factors that I mentioned. Now it has become pertinent for consumers to start using digital technology because of convenience, because of options, and more because of price points and stuff. It has become very, very important for enterprise, driven more by commercial need to be profitable, cut down cost, bring in the right workflow, automate, use data for decision making, and government to see that that we have platforms that can help do population management, provide access to places and population that have so far been bereft of this kind of healthcare provision. So all that had started to play. Now, unfortunately, because of a very shallow investment environment when it comes to VC early stage, we see activity in very certain pockets. And as you would be reading, the biggest activity or the most talked about activity is in the whole booking platforms. So like e-pharmacy, your telehealth, these are the models where 70-80% of the money has been flowing in. So that's one set of investment attraction. The other set of investment attraction is mainly on the clinical decision support models, but these are more regulated market oriented. These are not meant for the domestic market. What we need is just the way it's happening in the US, which is bringing digital technology across the value chain and across the consumer usage cycle. That is what is going to deepen the digital healthcare space. Investors are excited, but today we only see pockets of success, which are very few verticals. Beyond that, we are yet to see successful models. But the good thing is that all the stakeholders have started talking about digital health and there is an increased interaction with investors, and that should be a positive trigger for the market to get into a virtuous cycle of entrepreneurs coming in, investors backing, and you see a success.
Sure. Thank you, Sunil. I just have one quick question on what you said. You can answer now or in the course of the discussion. So, in the conventional inverted comma areas like healthcare delivery, hospitals, diagnostic center, especially hospitals, are you when you look at investments in future and your own idea as an expert in this area where the funds will flow, do you think they have to remodel themselves? I mean, Santosh is here. Two of the biggest chains, senior leaders are here. Do you foresee, I mean, would you like to sort of stick out your neck and say, unless they do this, there'll be issue in getting funds in future, however good they may have been in the past?
No, that would not be the case. See, the reality of a market like India is that India is not going to disrupt and become digital. At best, even in the next 5-7 years, we will remain a phygital model.
Okay.
If you give us if you give us an option to invest,
yes,
we would be most comfortable investing in a phygital model, which is both physical and digital. What we expect from the traditional conventional model is how do you start using technology for workflow? How do you start using technology for clinical decision support?
Sure.
How do you start using technology for business decision support?
Okay.
These elements have now become important.
Excellent. I think that's
it's not in your control. Cost is in your control.
Okay. No, thank you very much. I think that's because various people are talking about disruptions in various form. So what I hear from you is that India more of a regular kind of transformation, perhaps, instead of something radical. Thank you, Sunil.